In our country, doctors are scolded as kashai, which means a butcher. Yes, surprisingly, some people actually do that. In our country, doctors are often faces a lot of harassment. Let's focus on this miserable doctor-patient relationship. All over the world, doctors are considered next to God. They are the life saviors working tirelessly for the mankind. But in our country, the scenario is totally opposite. Here, people are not concerned about doctors' sacrifices. Doctors are blamed for the mismanagement of the higher authority and hospitals, even for the unclean floors, beds, and toilets, as patient thinks these are the maintained by the doctors. So where is the problem? Did you ever think? A proverb is said, it is always takes two to make a quarrel. Patient complaints are not always meaningless. Some of the problems are created by our doctors, but most of the problems are caused by our crippled system. If we want to talk about the negligence, it means doing something that is not supposed to do. And medical negligence is the absence of reasonable care and skillful negligence of a doctor during the treatment of a patient, which can cause bodily injury or death to the patient. Sometimes our doctors do also unfair to our patients. Our doctors study about the morals, ethics, and medical etiquette throughout their student life, but they fail to apply these during their professional life. These are not the recent problems of our country. As it is previously mentioned, it is our broken system which is the main culprit. There is no proper management in the government hospitals. Even the salaries given to the doctors are not enough, which leads them to run after money. As far as I know, maybe Bangladesh is the only country where doctors take fees directly from the patients, which greatly impairs the dignity of this noble profession. On the other hand, also most of the healthcare professionals are not concerned about their professional right. Most of them do not know what to do in their professional critical situation when it is under threat. This happens due to the lack of knowledge about medical jurisprudence, which deals with the application of law for guidance of their medical profession throughout the whole life. Because of these lackings, our doctors are easily harassed. Even there is no proper law by which the offenders who harasses doctors can be taken into action. And if there is no proper law, there will be more harassment. If there were proper law enforcement for the doctors, offenders would think twice. Even the communication between the doctors and the ministry is so poor that the doctors often fail to fulfill their demands. Our doctors successfully invented ORS and saved millions of lives from cholera. The condom catheter method or Saibas method also invented in our country by our doctors. Our doctors are serving worldwide with pride and dignity. It is time to think about our own future. It is time we should raise our voice for our own security, for our own secured workplace. It is time we can hope for a beautiful nation. So, what steps should be taken? Proper law should be established for doctor safety. Any violence or harassment against doctors should be considered as non-bailable offense. A doctor should always have a sound knowledge about the medical jurisprudence, ethics and etiquette throughout the life. Hospital management system should be improved. Doctors should be given proper salary. Communication gap between the doctors and the ministry should reduce to zero. Government should take proper steps to improve the doctor-patient relationship. Mass medias like television, newspapers should support our doctors. As in future, I am going to be a doctor if everything runs well. I want a secured, healthy workplace. I want to serve this lovely nation with honor, dignity and safety. I want to be a part of this revolution to change the system.